Welcome to everyone that's joining. We'll wait just a minute, make sure everybody can join with us, and then we'll get started. Welcome everyone to our open enrollment meeting for 2022. We will be presenting on the health insurance and some of the other benefits that we have to offer today. It was good to see many of you in person last week at our benefits fair. We appreciate those that were able to attend. And so we will go ahead and get started. This webinar will be recorded and will be posted out on our website as soon as we can get it out there, so that you can review it again. I will ask that if you do have questions to go ahead and put those in the Q&A so that we can answer those. I would ask, since this is a public meeting, that if you do have any personal questions, that you wait and contact one of us in benefits or join one of our breakout sessions next week or over the next couple of weeks, so that we can talk privately about a personal situation. So we're going to go ahead and get started. So our open enrollment dates are started May 20th or April 20th, and we'll go to May 20th, and then all changes are effective July 1st. The one thing that's staying the same is the college contribution to the health savings account. It'll be $1,200 for single coverage and $1,600 for family coverage, and that will be reflected on the July 22nd paycheck. So we did have a few changes this year. As you might have seen in the email that went out a week or so ago, there are some premium changes. And then we have also increased deductibles on the health plans. And then we are adding a new Roth option for the 403B and 401k. We'll be rolling that out in stages. So TIAA will be first in May, and then Fidelity in June, and URS in July. So watch for more information on that. So the steps you need to take, we encourage everyone to enroll or log into the benefit portal just to verify your coverage. If you are participating in flexible spending or the health savings account, you do need to re-enroll in those, especially with the health savings. If you want the college contribution this year, you do need to make sure that you re-enroll. And then if you have been participating with the legal ease or ID theft coverage, you will need to re-enroll in those as well. If you don't want to make any changes, the other coverages will roll over, but except for the flexible spending and health savings and legal and ID. So with that, I'm going to turn it over to Elizabeth. Thank you, Elizabeth, for joining us. She is our representative from Blue Cross Blue Shield. So she is going to go through the slides on the medical plans and dental and some of their other benefits that they have. And then I will follow up with the slides on the flexible spending and health savings accounts. So I'll turn it over to you.
Thanks, Patty. Good morning, everyone. My name is Elizabeth Brown, and I am the college account executive from Regence Blue Cross Blue Shield of Utah. Like Patty said, it was great to see a lot of people at the open enrollment benefit fair last week. It's so nice to get together again. I'm going to go off camera so I don't have any technical difficulties. And I'm going to go over medical and dental benefits effective July 1st. Okay, so we're going to start off with the dental rates effective July 1st. They did go up slightly, and these are the new rates per pay period for employee, two-party, and family. And then moving on to medical rates, again, they went up slightly. And you have the traditional plan with the copays and the high deductible health plan. And then you have the 3 network participating, preferred value care and preferred focal points. The only one that didn't go up was the high deductible health plan with the preferred focal point. It's still zero premium. Okay, so we do have 3 networks. Let's start with the dental plan, which is separate. We have a great network, a really wide network for dental. We have close to 1,300 general dentists, close to 350 specialists. And if you have anybody out of state, if you have somebody going to college or an admission, we do have a really good national dental network with over 284,000 dentists. And then we also negotiate fees for all our services. So we have a negotiated fee schedule for all claim types. Okay, so let's talk about networks. So there's 3 networks. The most expensive is the participating network. It has all the 52 hospitals in the States. The next one down is preferred value care, or just value care. It has 42 hospitals. And then the least expensive, our narrow network, it has 15 hospitals. Now, this year, we increased our provider count for the focal point network. It used to be a little bit over 8,000 providers. We now have over 11,000 providers in focal point. So if you're considering going to focal points, you may want to check to make sure your provider is in network. If you log into your account on Regence.com, because you're logged in, it's going to pull in network provider on the network that you're on. Now you can search for providers not logged in, and you can search for a focal point if you just want to look and see if the provider is in network. And this is a really good flyer. It may be hard to see on the Zoom meeting today, but you can contact HR. They have this flyer. It just puts the networks side by side. So the one with all the hospitals that are participating is this one in light blue. And then you got PVC, which stands for Preferred Value Care, and then focal points. And so you can see the one with the X are the hospitals that's in that network. And then on the left-hand side, you have the provider counts. And even if you pick preferred value care, who doesn't have the IC hospitals, you do have access to the InstaCares. And also we have value-based providers, and these are the clinics that we partner with on the left-hand side. So you also have a great network out of state. You connect to one of the largest network in the United States. And when you connect out of states, it's called Blue Card. So you carry your benefits out of state, but you just want to make sure whoever you go to is in network. So you have a couple options. You can go to Regence.com and search if you're traveling or in another state, or you can go to bcbs.com, listed on this slide. And search for providers. You just need your ID number and your alpha prefix to search for providers. If you are traveling out of the country, we have a global core app that I recommend that you download. It will help you find providers. It will also help you with translating and medication and so forth. If you ever need to seek services out of the country, there's a number you want to call before you go to the hospital, unless it's emergency. But just know that you have great coverage out of state and as well as out of the country. We cover over 190 countries. Okay, so let's talk about pharmacy. This is a little bit of old and new. On the left-hand side, I just want to remind you, we have 2 vendors for specialty and mail order. Your specialty pharmacy is Accredo, and your mail order vendor is Express Scripts. So that hasn't changed. If you need to utilize them, you can go onto Regence.com if you want to sign up for mail order and have it shipped to you. Accredo, you can pick up your specialty if you need to have a specialty prescription. On the right-hand side is something new that we added. This is a new network pharmacy. It's the Amazon Pharmacy. And so instead of going to Smith's, Walgreens, you can actually get your medication through Amazon. You can set everything up with your ID number. You can transfer your prescription, either have Amazon reach out, or when you go through the step-by-step to get it filled through Amazon Pharmacy, it will tell your provider, this is the information they need to get the prescription to Amazon. You don't have to be a Prime member. You will get access to the free shipping if you have Prime, the 2-day free shipping. If not, it will be a 5-day shipping. But everybody's familiar with Amazon. You can track your prescription really easy. And it's just another vendor that we added to the network. Okay, so let's look at the benefits. This is a traditional plan with copays. Nothing has really changed except for the deductible. So the new deductible effective July 1st is $150 per individual, $450 per family. You don't have to pay the deductible for generics or mail order. Your out-of-pocket maximum is the same, $2,000, $6,000 for family. And then retail, you can get a 90-day supply at the retail pharmacy. And there's a $7 copay deductible rate for generic, which is going to be your cheapest. And then everything else stays the same. And this is the high deductible health plan, which you have to meet the medical deductible before we start paying. And that includes prescription, unless it's a preventive prescription, or is on an optimum value list that I have a slide on. I think it's the next one. So again, there is no changes except for your deductible went up. Everything stays the same on the pharmacy on the high deductible health plan. Okay, this is the list that I was talking about. So we have what we call optimum value medication list. It's usually generic, but if your medication is on this list, you don't have to pay your deductible. We will waive the deductible. And it's a long list, so I recommend going to Regence.com to see the latest list. We update it yearly. And it's usually for chronic conditions like high cholesterol, depression, diabetes, and asthma. But definitely, if you want to take a look, go to Regence.com and look at the latest. Okay, so definitely take advantage of your prescription coverage by going to Regence.com. If you're not sure, I would just check it out and see what we offer. You can search for in-network pharmacies near you if you're not sure where to go. You can also search for drugs. If the doctor says, I want you to take this drug, you can see if it's a brand name, or you can see the generic equivalent. Of course, generic is going to be the cheapest. But definitely take a look, go to Regence.com. We also changed a few years ago. If you have a blood glucose meter, you can pick it up at the pharmacy as well as using it on the medical. So if you want, you can pick up the meter at pharmacy as well as a durable medical equipment provider. Okay, so this is a couple of screenshots from the website. So you're going to see your benefits. You can see exactly how much you need to pay for each drug. And this is on the bottom left-hand corner, you can see if you search for a prescription or for a drug, you're going to see the brand name and you're going to see the generic, and it's going to give you an average cost. So definitely, if you have a prescription, you're not sure how much it is, if you're not sure about your benefits, go ahead and go to Regence.com and you can see what tier the drug will fall under. Okay, so we have a lot of tools. I hope you take advantage of them.
We do have a few questions,
yeah.
Elizabeth. I wonder if you want to.
Absolutely.
Can you see them, or do you want me to read them to you?
No, I can see them. Would U.S. territory be included with our out-of-country services? Yes, absolutely. They would be included. If you're there and you need to seek services, call the number on the back of your card and they will tell you where to go. And then claims will just process just like any other domestic claim. It may take a little bit longer. If you have to pay upfront, do so, get a receipt, itemized receipts, and we actually have an international claim form that you can fill out and it will process just towards your benefits, but absolutely. For employee plus spouse, is the deductible 150 times 2 or the 450? That should be, family is 450. So correct me if I'm wrong, Patty, that should be the 450 for employee and spouse, right?
Right.
Okay. Okay, next one. Does Focal Point have any urgent care facilities? From what you say, you can't go you can't go to Instacare on the lowest plan. Yeah, so Focal Point does have some urgent care facilities, but not as many. I wanted to point out that Preferred Value Care has the IHC Instacare because it's IHC, and if you are on the Preferred Value Care, you don't have access to the IHC facilities, but you have access to their Instacare. You would have to look up, if you're on the Focal Point network, do a search for urgent cares, and it will tell you which ones are in the network. Okay. Why does the deductible jump for just 2 people to the cost for more than 2? I'm not sure if that's a question related to the traditional plan.
I think it's related to that deductible question up above. So the
Yeah.
150.
Yep.
And typically my understanding is that it is the 150 for the single or the 450 for anything that's more than the single, but we can double check that, Anne, for you.
Yeah. Okay, good questions. Keep them coming. Okay, so first of the year, we redesigned our website to make it more user-friendly. Just know that you have the same experience on the website as well as the app. So I hope everyone has an account. Next slide is going to show you, you can download the app from the App Store. You can use it on your iPhone or your Android. You can see ID cards, benefits, claims, EOBs. You can search for in-network doctors, estimate your out-of-pocket cost. So if you don't have the app, I do urge you to log in or to download it and log in. Okay, so like I said, you have everything in one place. This is just a screenshot of the dashboard that we have. Like I said, you can do everything. We've made it user-friendly, so the most important stuff and the most searchable has been set up on the dashboard. If you don't want to if you don't want to call customer service, you can also chat with them or email them. And then we do have a lot of other resources like wellness and so forth. This is kind of a busy slide, but this is the dashboard. And like I said, you can get a lot of information just from the dashboard. You can see your ID card. You can email your ID card if you have somebody out of state in college, or if your provider wants you to email it. You can chat with customer service. As soon as we put a claim in the system, you can view it on Regence.com or the app. Now, it could take up to 30 days to finalize. But as soon as it's final, you're going to see how much we paid and how much your responsibility is on the website. You can estimate cost also if you have any procedures, and you have access to behavioral health options, our wellness programs, telehealth, and discounts. So this is a screenshot of the treatment cost estimator that we call it. You have to be logged in to use this because it will show you cost for procedures based on your benefits. So you can search for providers, you can look at reviews if you're not sure who to go to. But when you look at procedures to see how much your cost is for like a knee surgery, it will actually give you cheaper alternative. Let's say you have to have an MRI. It will give you alternatives to go to different places if you want to pay less. But definitely take a look at it if you're having any procedures. These are the most common procedures. So if you're having a pretty unique surgery, we probably don't have enough claims cost to add it to the treatment cost estimator. So just know that. But I would definitely go on here and see how much it's going to cost and see if you have any cheaper options before you have any procedures. And this includes MRI, CT scans, and so forth. So you have access to telehealth through MD Live, which is a vendor. You can download the app, or you can go to Regence.com and register. I do recommend registering now, so you're set up when you get sick. You can just sit on your couch and talk to a doctor, excuse me, or do a video. They do give you prescriptions. This is more than a nurse line, and it's also available for spouses and kids. 24/7, 365 days. And it's $10 for on the traditional plan. And if you are on the high deductible health plan, you do have to pay for the whole visits, but it's only $42 until deductible is met. Then you pay $10 copay for a medical visits. So these are just some common issues that you can use it for. It's not for life and death, but if you have fever, sore throat, pink eye, allergies, definitely try MD Live. They do have pediatricians, so it's also good to use for your kids. And behavioral health has been a higher demand lately because of the pandemic, and it's kind of hard to get into providers to see them. So behavioral health through MD Live is a great options. They have, you can use them for parenting counseling, problems at work, if you're stressed, behavior issues. So it's also used for behavioral health. So think about that. If you can't get into a provider, try MD Live for behavioral health. This is just a flyer that we have for MD Live, just, promoting it, saying that, try it. It's great. It's 24/7. Set it up before, so it's already ready to go, because you have to register with your ID number because it's going to pull in your copay or your responsibility. But definitely give it a try. And if you're pregnant, we do have a maternity program called BabyWise. It will give you regular updates, what to expect during pregnancy. You have access to a nurse 24/7 you can call. If something is bothering you at 10 o'clock at night, you have access to a nurse and you can double check and ask them questions. If you're high risk, you do get regular contact from an assigned nurse, and they have a wealth of information, expert information about nutrition, breastfeeding, and common pregnancy concerns. They do have an app called Due Date Plus that you can track your every step of the pregnancy, and that's the phone number to register and get started. And because there's such a high demand for behavioral health providers, we have added these 4 to our networks. These are all of them except for Charlie Health. They're all virtual. So Talkspace, you can get counseling, therapy, and medication services just from the website or your phone. Boulder specializes in substance use disorder, and No OCD, obviously treat OCD treatments. And then the last one is Charlie Health. They do virtual and in-person, and they are designed for teens and young adults. So if you search for providers for behavioral health, these are going to come up, and these are virtual options that just including in our network. And this is not new, but you can actually do medical supply shopping on Regence.com. Because medical equipment could be quite expensive. You can use a durable medical equipment provider like Alpine Home, but we have also made it available on Regence.com. You're not going to have all the durable medical equipment on there, but the most common like crutches, breast pump, CPAP. So log in. It's going to take you to Amazon, but it's not just Amazon, it's our Amazon. So you need to make sure you go through Regence.com. So you can purchase crutches or anything that you need, and then we have a claim form, electronic claim form that you can fill out, and you can submit it online. You don't have to do any paperwork, and the claim will just process towards your durable medical equipment. So take a look and see if your equipment is available and try it out. Okay, so we all want to be sure to get our screenings done. So I just want to mention that we follow healthcare reform. We do have the guidelines and criteria you have to meet on Regence.com. There's a great flyer. I think we just came out with a new one actually the other day. So if you need to do your colonoscopy or your mammogram or your checkups or any vaccinations, take a look and see. Make sure you meet the criteria, you can see what's covered 100%. It has to be billed preventive to be covered at 100%. If something is not coded preventive and it's not on this list, it's not going to be preventive. It's going to go towards your medical benefits. So take a look at preventive services. Okay, and last, I just wanted to let you know if you have been diagnosed or if you have type 1 or type 2 by diabetes, we do have a diabetes management program called Livongo that you can sign up for. Once you sign up, you'll get a glucose meter, a little package with everything included. So take a look at it. It has real-time data analytics that you can share with your provider. They have great support 24/7, 365. They also have live intervention. If there's something wrong with your numbers, if they're too high or too low, it will actually call you and it will talk you through what you need to do. And the best part, you can get free unlimited supplies just shipped to your door. So you don't have to pay for the supply through the pharmacy. So definitely, if you're diabetic, this is a great program to sign up for. And I think we have some questions. Let's see here. Okay, so let's see here. Let me go up to. Okay, so are you able to explain how the high deductible plan works, please? Yes. So high deductible health plan, you have to meet your deductible for everything except for preventive services, preventive medication, and there's a list on Regence.com, or if your drug is on the optimum value list. Other than that, you have to pay your deductible before we start paying, which means if you go to the doctor and you haven't met your deductible, you need to pay for the visits. You will pay our contractor rate. So let's say you go for a medical visit, let's say it's $150. You can use your HSA account, your health savings account, to pay for that visit. And you just use your card until you met your deductible, then we start paying. So a high deductible health plan comes with an HSA. And the college will give you the money that Patty told you in the beginning, but you can also put pre-tax dollars into the HSA so you have it in case you're having a big procedure. And it will roll over, it's your money. So if you have a good year, you don't have a lot of expenses, that money will roll over and maybe next year you need to have a procedures, it's your money to use. Okay, let's see. Do you have a specific list of providers of color? Yes, you can search on Regence.com and you can filter on the left-hand side, you can filter if you want to see certain providers. So we do have that available. Let's see. I'm thinking about switching to Focal Point. Is there a way to see what facilities care I can access without having the member ID or group number? Yes. So the flyer that I show on the facilities, HR has that available, and I think this will be available. This recording will be available, but HR can give you the facility flyer that will show you the facilities that are in network for Focal Points. If you want to search for providers and you're not in Focal Point, don't log in. Go to the website in the upper right-hand corner, click on Find a Doctor, and you're going to search for the network, and it's called Preferred Focal Points. Once you elected the network, you can search for providers. Good question. MD Live is available for all plans. Yes, all plans, all networks. Good question. Mental health services, are they covered as preventive under the high deductible health plan? No, mental health is not considered preventive. Let's see. Do you have to pay cash price for medical expenses in the HSA plans or insurance copays rates? So like I said, you actually pay our contractor rate. If you haven't met your deductible, it's not the cash price, it's our contractor rate. So let's say it's $150 for a doctor's visit. That's what you're gonna pay using your HSA money. Okay, I think that was it. Okay, so I'm going to continue to talk about employee assistance program through Uprise Health. So the college has done something really good for all their employees, full-time employees, effective July 1st. You're now going to have access to 8 visits. And part-time employees now have access to 4 visits effective July 1st, which before or currently, they don't have access to any. So this is a great resource. Behavioral health is definitely something that is needed, and you have several resources, and this is one of them. So take advantage of it. Next slide. So we all face challenges and every employee is different. So just know that you're just a phone call away to resources if you need it. Counseling services are great. They meet your need. They meet your level of care, that connect to you, wherever you're at in your care. Available to employees as well as dependents, and also around the clock confidential access. They have short-term counseling. You can either do phone, video, or face-to-face sessions. What they do is they ask you a few questions to match you up with a counselor. And then you actually have 8 sessions per issue for each member of your household. And that includes employee, spouse, and unmarried dependents up to 26. And you can schedule your own appointment, or they can also help you schedule an appointment. They also have something that's really cool. It's an online peer support group. So if you want, you can join a support group with others who have similar issues. You can share ideas, support, and encouragement. Here's a couple of support groups that they have: anxiety, depression, grief and loss, parenting. So if that's something that is interested to you, definitely join one of their support groups. And they have a lot of other resources. I mean, it's always hard to balance work and life. So just know that they also have access. You also have access to legal services, financial services, child and parenting resources, elderly care. They have a lot of training and webinars if you're in a supervisor position. So definitely know that you have access to Uprise Health, and they have a lot of resources. And now I'm going to turn it over to, let me check to make sure we don't have any more questions. 1 second here. Okay, so for the traditional plan, do you have to pay the deductible before Regions kicks in, similar to the high deductible health plan? So traditional plan is the one with copay, and then you have the high deductible health plan. So traditional plan means that you have access to a doctor and prescription with just a copay. You don't have to meet the deductible, except for the certain prescriptions like brand name, you have to meet a pharmacy deductible, RX deductible. But it doesn't work like the high deductible health plan where everything is deductible. Good question. Let's see. Yeah, so one question is, be careful where they send your blood work, because if they send it to an out-of-network hospital, it will go out-of-network. So it's a great point. You can ask them what lab they send it to. Our preferred lab is LabCorp. Sometimes the clinic will have a sign in the office, in the lobby, saying that this is our preferred lab, but you can always ask what lab they use and then check with us to make sure it's in network. We do have some great rates that we have negotiated with LabCorp. So good question. Okay, I think that was it, Patty. I'm going to turn it over to you.
Thank you, Elizabeth. That was great presentation. And I know you'll need to jump off here soon. So thank you again for spending some time with us this morning. I'm going to work through our flexible spending and health savings accounts through Health Equity. So basically, these are ways to help you build savings or save tax dollars on certain healthcare expenses. So with the HSA, as was mentioned earlier, if you are enrolled in the high deductible health plan, then you are also eligible for a health savings account. And that is a great account, or a great way to save money pre-tax, and then have it roll over from year to year to use for those expenses. So like I said, it is combined with the health plan. You do have to have the high deductible health plan to have the health savings account. And a comparison between the traditional health plan, generally the premium is a little bit higher, but you do have that lower deductible. Many of the office visits and things are, the deductible is waived. versus the high deductible health plan where the premium is lower, but your deductible is higher and you do need to meet that before anything will be paid or covered under that plan. But you can also put money into the HSA, and the college contributes money into the HSA plan as well. So you contribute on a pre-tax basis. The college will also contribute. That money goes into your HSA, and then you can use that money to pay for qualified medical expenses. There is a Visa card that comes with that account that you can use, or you could file a claim and be reimbursed. So there are some IRS limits to maximize these accounts. And so that is the limit for single coverage is $3,650 this year, and family is $7,300. And there is an additional amount if you're over age 55. These examples of tax savings are based on a tax bracket of 20%. So that may or may not be your situation as you're putting money into these accounts. So again, the college will provide or contribute funds to this account. And then you can put money in through a pre-tax deduction through your payroll. You can change that at any time. You can do an ongoing deduction, or you can schedule a one-time deduction, however you want to do that. So the IRS does have some requirements to be eligible for an HSA. You can only be covered by the HSA. So if you have other coverage, including Medicare, TRICARE, or a traditional plan, even through a spouse, you would not be qualified to have a health savings account. If your spouse has a flexible spending account, you would not be qualified. And that's something that can sometimes be an issue if their plan, if your spouse's plan is on the calendar year. So they've signed up in January and now you're trying to make some changes in July. If that flexible spending account is in force, you would not be able to contribute any money to the health savings account until the next January, when that flexible spending account could be canceled. The other criteria is if you are not claimed as a dependent on anyone's tax return. So the health savings accounts are also a great way to have money for savings in retirement, especially for our healthcare needs. This is a statistic, looks like back from 2019, of what an average couple would need for their out-of-pocket healthcare expenses during retirement. So healthcare or health savings account funds can be used for qualified medical expenses not covered by Medicare. So once you're in that retirement situation, you can continue to use any funds in your account to pay for those expenses. And some employees look at this as just another way to help put savings away for their retirement. So you might be contributing to a 401k or 403b, and this is just another vehicle to allow you to put money aside for your retirement expenses. So Health Equity has both a website and an app, and they can you can log into those, see your balances. They also are integrated with TIAA, and I may have missed that on the previous slide. Once you have a certain balance in your health savings account, you can actually invest that money and help it grow just a little bit more. And those investments would be through TIAA. So if you have a health savings account and log into your TIAA account, you would actually be able to see your health savings money there as well. So that's a great partnership that they have. So that's it on health savings accounts. The flexible spending accounts is another way to save, and this would be primarily for those that are in the traditional health plan, or if you are maybe covered by a spouse's plan, you could have the flexible spending account here. This is again a way to save taxes on those expenses, and it would include medical expenses and qualified dependent care expenses. So these are pre-tax contributions. you do the election for the year. So the maximum is $28.50 for the year. So if you chose to put the full $28.50 into this account, that money is actually available to you on July 1. It's loaded into your account and available on that Visa card that you would receive. And you could technically spend all $28.50 in July if you had those expenses in July. And then throughout the year, the college is going to continue to take that money out of your paycheck on a pre-tax basis to fund that account. The dependent care works slightly different. It has a $5,000 family maximum, but this isn't available all up front. You would, once the money is in your account, then it can be reimbursed. So you would pay for your daycare expenses and then be reimbursed for that expense. You do need to be cautious with these accounts, because if you don't use all the money that you've put into this account during the year, you do lose it. The year is July to June. So we just ask that you be conservative with the amount that you're going to put in here. But if you know certain prescriptions that you're going to fill throughout the year, or certain provider visits that you're going to have, you can kind of estimate what those might be. You are required to document your purchases or substantiate them. This is an IRS requirement. In many cases, that can be automatic based on the claims, because Health Equity does have a partnership with Regents. And so some claim information would come through and they would be able to match that up and substantiate that expense. They may ask for information to substantiate a claim, which is usually an EOB, estimate of benefit or itemized receipt. This is just an idea of what the documentation should include. The names of provider, patient, description of the service, dates and cost. A credit card receipt or canceled check would not be sufficient. And I mentioned the auto substantiation. So for a lot of things that happens, I know dental and vision tend to be the ones that they ask for documentation on. So just kind of be aware of that as you're having those expenses. So it's easy to sign up. You would go into the benefit portal and elect either the health savings or the flexible spending account. And then we would take that out of your paycheck throughout the year. They do have an app, and then here's a copy of the Visa card. The app is great. You can check your balance, review transactions. You can actually submit claims through there, or if you have a provider you need to send a payment to, you can actually initiate that through the app. They also have a comparison tool at comparemyhsa.com, where you can kind of look at both the traditional plan and the high deductible health plan side by side and make some comparisons. They also have what they call account mentors available. They are available 24 hours a day to help with any HSA or flexible spending account questions that you might have. If the card's not working or something's not going through, or you do have questions, they are available. I think that's all for our health savings account. Let me check the questions. So a question for the FSA: do you have to submit receipts to get reimbursed, or do you get a credit card like the HSA? You do get a credit card. So you would have that available to you, or if you do choose, you could submit a receipt anytime throughout the year. So a question: how do you re-enroll for the HSA contribution? So you would need to log into the benefit portal. The easiest way to do that would be through the employee tab on My SLCC. You'll see it on the right-hand side underneath the employee dashboard link. That will take you through, you'll come to a page where there'll be a blue button up in the right-hand corner that says, I believe, click here to get started. We're enrolled now. I don't remember what it says. You're going to click through a couple of times and it's going to take you to the workflow where if you want to make changes to your health plan, you can. But as you scroll down and work through that workflow, it will walk you through the health savings account enrollment. Question about if you run out of the FSA balance, can you put more in with pre-tax contributions? Once we're in the plan year, no, the only time you can change an FSA account balance would be if you have a life-changing event. So if you put in a little bit of money and then get married, that would be a life event that you could increase the amount that you're putting into the FSA, or you have a child. You do have to make those changes within 30 days of that event. So someone's asking about the number for the account mentors. Let me back up. 866-346-5800. It would definitely be on the website or in the app. It may also be on the back of the card. And let's see. Are we automatically enrolled in the Vision program? We do automatically enroll new hire. When we have new employees, we automatically enroll the employee. They would need to add any dependents to be covered. So if you are currently enrolled, we will just roll that enrollment over with, unless you want to make a change. But that's why it would be good. We encourage everyone to log in and just double check, make sure you've got everybody covered that needs to be covered. The college does pay for the Vision plan for the entire family. So that would be good to make sure you have everybody enrolled in that. Question, if you are not part of the TIAA retirement, can you still invest your HSA funds? If so, are there fees associated? You can still invest your funds. I believe there are a couple of fees associated depending on the fund you choose to invest in, but all of that information would be on the Health Equity app when you're walking through that investment information. Where on Health Equity can I compare HSA versus FSA? So the comparison tool compared the health plans. I would have to go out. I haven't been on their website for a few days, so I'd have to go out and look to see if there is a comparison to the two plans. Paul, I will look at that and see if I can send you something on that comparison. Just making myself a note here. We will also have coming up starting next week some open, what we're calling open labs. These are Zoom meetings, and we'll be sending out those links again. They were in the original open enrollment email that went out a couple weeks ago. But with these Zoom meetings, you can drop in at any time within these time frames, and we will be, members of the benefits team will be in breakout rooms. And so you'll be placed in a room with one of us where we can help you individually go through either enrollment or answer your specific questions. So we would encourage you to join us in one of these Zoom meetings if you do have questions. Another question about the FSA credit card. Do you have to also submit receipts or just keep them in case of an audit? So you should keep them in case of an audit for the FSA. Again, they may still ask for some substantiation. So if you used your FSA credit card at the dentist, they'll see that charge come through, but they're not going to know what it's for exactly. So you will end up probably having to supply some more information from that visit so that they can substantiate. But it would be good to keep those receipts. Same for the health savings account. That plan, the health savings account is viewed a little bit differently in that it's the employee's responsibility to make sure that you're using that account for the correct expenses. We don't ask for, or Health Equity doesn't ask for any substantiation on the health savings account. It would just be that if the IRS chose to audit you or look at those expenses, then you would need to provide those receipts. So it is always good to keep those receipts. And I know with the health savings account, and I think with the flexible spending account, there is a way to attach receipts to invoices or bills or claims in the Health Equity app. There's a way, kind of a shoebox, where you can scan a receipt and load it in there and keep track of that. So any other questions? So I appreciate those of you that have spent some time with us today. Like I said at the beginning, we will have this recording available on our website as soon as we can get it loaded up on there. And we look forward to seeing you at one of our open labs if you do have questions. Question asking about the eye insurance and what plan is Costco under. Costco, I believe, is under both the VSP and the IMED. I do know that some Costco eye doctors are not covered under VSP, but you should be able to go to Costco and get your glasses. It just may be that the office visit isn't covered. But you can go, we have links out on the benefits website for those, for the vision plan, and you can go out and look at that as well. So any other questions? All right, I'm not seeing any other questions. So thank you, everyone. I'll hang on here for a few minutes to see if we do have any other questions, but we appreciate you spending time with us today. Thank you, Mike. I think we can stop the recording now and end the meeting.